Greetings, hello, hello. Sorry about being a little bit tardy here. I'm still learning the technology. So, welcome. My name is Daryl Russell. I'm an independent agent. I'm also the owner of Affordable Medicare Supplements, AMS for short. We're an independent insurance agency here in Overland Park, Kansas. So, actually recording now live from our studio, converted office that we converted into a studio here. So, thanks for joining. Keep in mind, this is live on YouTube, and while you can't ask questions over the phone or through a speaker, you can ask questions one of three ways. Questions are available either through the chat menu feature on YouTube, on your laptop, even your smartphone, iPad. You may not see that on your smart TV. So in those cases, if you will just send us a text to either 913-214. So they can see your smiling face. And then we'll go ahead and get started with the presentation. So reach in, there he is.
Hello, everyone. Thanks for joining.
Alrighty, so enough of that. You're here to learn about Medicare. I've been doing this for a little while, and I hope you find the program helpful. So I'm going to join in the picture-in-picture up here in the corner, and let's do this. So I'm a big trainer. I love to use government resources. So everything that we reference is either from the official Medicare publication, Medicare and You. There's a companion book that we use a lot on Medicare Supplements. It says it's the 2019. They still haven't released the 2020. They're typically a year behind, but it is what it is. So basically, when you're dealing with Medicare, we're dealing with four parts. And I'm going to run my mouse over here a little bit and try to stay out of people's way. But Part A, which is hospital coverage, and Part B, which is medical insurance, this is your original Medicare. So whenever I use the term original Medicare or red, white, and blue Medicare card, I'm talking about Parts A and B. And this is all managed by CMS, the federal agency in charge of the Medicare program. The red line is dividing other parts of Medicare, which are offered by private insurance companies who all are under contract to CMS. And that's where it'd be your Part C, your Medicare Advantage plans, as well as the standalone Part D prescription drug plans. So, to be eligible for Medicare, you become eligible for Medicare one of three ways. The first day of the month that you turn 65. If you've been receiving Social Security disability benefits for 24 months, regardless of how old you are, you will receive Medicare on the first day of the 25th month you've been collecting Social Security disability benefits. And thirdly, if you or someone you know is ever diagnosed with Lou Gehrig's disease, ALS, or end-stage renal disease, which is defined as permanent kidney failure requiring dialysis, you're waiting on a kidney transplant, then you get Medicare regardless of age. And you must have Parts A and B together to be fully insured. And we've got a mock-up of the new Medicare card. They've gone to a unique to each person Medicare ID number, so no longer Social Security numbers on there, which is cool. So let's go ahead and take a closer look at just exactly what do you get under Part A. What does it cover? Well, Part A is your inpatient hospital coverage of Medicare, so your brick and mortar, if you will. You start off with a Part A deductible of $1,408 per benefit period. So, in other words, if you go into the hospital for 2 days, you would have that deductible, and then Medicare pays basically everything else. As you can see, there is a copay of $0 for the first 60 days. You would have to be in there longer than 60 days to where you would see an additional charge on top of that Part A deductible. But that does not necessarily have to be consecutive. But I think most people would agree nowadays it's harder to be in the hospital for long extended periods of time. So then, in addition to your hospital coverage under Medicare, Medicare will also cover some skilled nursing care. Now, skilled nursing care under Medicare should not be confused with long-term nursing home coverage. Skilled nursing care means you've had a surgery, you've had a health event where now you need some physical therapy, you need some speech therapy, something like that, to where you're going to get better and go home and no longer need it. So under those criteria, Medicare will cover the first 20 days, 100% of your skilled nursing facility coverage. And then after 20 days, you would pay the copay, which is currently $176 per day for another 80 days beyond the first 20. Medicare Part A also covers home health care. You pay zero, but this is very, very limited, and you're basically housebound. Medicare Part A also covers hospice care for the terminally ill, and then typically you would pay very little, if any, out of pocket for hospice under Part A. So again, that's your Part A benefits. What does it cost? Well, most people with 40 quarters of Medicare covered employment do not pay a Part A premium when they enroll. For those that do not have 40 quarters, there's the following premiums, and a non-working spouse can claim under a working spouse's earning record, but that doesn't happen as much nowadays. And as you can see, if you don't have the 40 quarters, we've got the premiums listed out here. Okay, so that's Part A, your brick and mortar. Now let's take a look at Part B of Medicare, which is your medical. This is all of your outpatient coverage. So you start with an annual deductible of $198. And this does change yearly. CMS sets the Part B deductible generally in the fall for the next year. Everything with Medicare is also calendar year, so maybe get used to thinking of that. The standard premium for Part B currently in the year 2020 is $144.60 per month for those with incomes below $87,000 as a single taxpayer, $174,000, for married couple. And this premium can and does change yearly. You can pay your Part B premium one of three ways: through Social Security deduction if you're drawing Social Security, or you can pay quarterly. They'll send you a bill, or you can authorize automatic bank withdrawal, and CMS will take that Part B premium automatically out of your checking or savings account. So what do you get for Part B? Well, after your deductible, Part B pays 80% of what they approve, and you pay the other 20%. And Part B includes your outpatient doctor visits. So your family doctor, your specialist, you name it, any outpatient therapies, durable medical equipment. That would be things like hospital beds, wheelchairs, canes, walkers, oxygen equipment, CPAP machines, that type of thing. If you go to the emergency room, Part B pays your emergency room visit, as well as most outpatient services, and that includes a lot of same-day surgery. So you have cataract surgery, that's going to be a Part B charge typically. And then, of course, your x-rays, your lab tests, blood work, and that, of course, includes MRIs, CAT scans, PET scans, that type of thing. There is no cap on how much your 20% can add up to. So let's take and give you a brief example of a Part B charge. It's no big secret that doctors and hospitals bill more than Medicare or any other insurance typically wants to pay. So you get a bill for $250 for a comprehensive visit. The doctor sends that bill to Medicare. Medicare receives it and says, you know what, we only approve $100. Assuming that you've already met your annual deductible, Medicare is going to pay 80% or $80. and they're going to leave $20 left over. Now, the amount over what Medicare approves, so anything over $100, is written off by the provider. Nobody owes it. This is commonly referred to as an example of Medicare assignment. Okay, so what's not covered by Part A and Part B of Medicare? Well, long-term convalescent nursing care, routine dental, dentures, routine vision. Now, Medicare does cover diseases of the eye. So if you had a problem with macular degeneration, glaucoma, diabetic retinopathy, those types of things, where there's an actual physically something wrong with the eye, that would be covered. So when we say routine vision, we mean I just need a new prescription for my eyeglasses. Refractive services are not covered under Medicare Part A or B. Cosmetic surgery, acupuncture, hearing aids, hearing exams. And there is a other list you can check on Medicare.gov. You can see additional items there, but those are the main ones that we get asked about. Okay, sounds great. I'm turning 65. I really don't have any other choice. How do I enroll? Well, for some people, enrollment is automatic. If you are drawing your Social Security benefits at age 65, or if you're a railroad worker, your Railroad Retirement Board benefits at age 65, you're automatically enrolled. You don't have to do a thing. Roughly 3 months before your eligibility for Medicare, either when you turn 65 or your 25th month of disability, you'll get a package in the mail with your red, white, and blue card, and you are ready to go. However, most people nowadays are delaying their Social Security to a later date, way beyond age 65. That may be because you get full benefits at 66 and 6 months, or up to 67, whatever that is. Many people are working to age 70, and they're just not drawing their Social Security. You can still enroll in Medicare, even if you're not retired, when you turn 65, but you do it online through the Social Security website. Again, you do not have to be retired, and you can start 3 months before the month you turn 65 in. So I've given an example here. This is a screenshot of the Social Security website, and it's just ssa.gov. And when you go in on the lower right-hand corner, you'll see this button here. It says Medicare Enrollment. Click on that button, and it will take you to this website. You'll scroll down a little bit, and it says right here, you can apply online for Medicare even if you are not ready to retire. And it takes less than 10 minutes, and in most cases, you don't even need to submit any additional documents. If they need something, they'll ask you. Click that button, Apply for Medicare Only. It will ask you to establish an account, username and password as far as my socialsecurity.gov account. Again, it has nothing to do and will not start your Social Security benefits if you don't want them to. It's just a way. When Medicare started in the 60s, there were Social Security offices all around the country. There wasn't any Medicare offices. So the government decided that Social Security, because they had offices everywhere, would handle the paperwork for signing people up for Medicare, and that's just never changed over the years. So that's why you enroll using the Social Security website. Okay. So let's get into the nitty-gritty a little bit here. When you are new to Medicare, either through age or disability, you have a 7-month initial enrollment period, or IEP. This is kind of like being new at a company somewhere. So it's the time window where you can do the paperwork without any delays or penalties. So we're going to start with the month that you turn 65, and think of that as your center point. If you have to enroll yourself, and let's say you turn 65 in the month of August, so then you could go to Social Security in July, June, or May and start the process of signing yourself up for Medicare to be effective August 1. If you wait until the month that you turn 65, so if you go and enroll on August 1, then you see that Medicare delays your effective date of coverage. So now it is the next month. So if you sign up August 2nd, even though you were turning 65 in August, you won't have Medicare until September 1. And then you can see that's 1 month after and as much as 3 months after in September, October, and November. You can still sign up to avoid penalties, but you do have a delayed effective date. So again, this I took right off of the Social Security website, which again explains that when those delayed effective dates. So in other words, and I kind of beat this into the ground, so that's what I get for not following my slides. It's live, folks, so anyway. All right, so we get asked a lot about late penalties. How do I avoid penalties with Medicare? Well, the late Part B enrollment penalty is charged to people who don't sign up for Part B during their initial 7-month period. And it's 10% of the Part B premium is charged for each full 12-month period that you could have had Part B, A and B, but didn't. And you did not have the reason for not having it. So down here below, you notice it says this is waived if you had employer coverage through yours or your spouse's active employment. And I use those words active employment a lot because that's how Medicare defines it. So we'll spend a little bit more time about that. So basically, if you don't sign up for Part B, don't have employer group coverage for each full 12 months that you could have had but didn't, you'll be charged a late enrollment penalty. Here I've given an example. Mary, we just made her up. She delayed signing up for Part B 2 full years after she was eligible at age 65, and she did not have employer coverage, employer health care coverage. So she just didn't want to pay the Part B premium, currently at $144.60. Well, now that she has decided to enroll, because she's found out she doesn't have coverage for doctors, she's charged 10% for each full 12 months, so 2 years would be 20%. And the Part B premium currently is $144.60. 20% of that is $28.92, which comes to a new premium of $173.52. However, the government rounds up to the next dime, so instead of paying $144.60, she will pay $173.60 in 2020. And in 2021, if this Part B premium is adjusted up, then her 20% will be on the higher premium. So we generally like to see people not have this situation. Okay, so while we're talking about Part B and things that hurt, we're going to talk about IRMA. IRMA stands for Income Related Monthly Adjustment Amount. And all IRMAs are based upon the AGI or adjusted gross income from your federal tax return, and they are on a 2-year rolling look back. So in other words, if you are new to Medicare in 2020, and your IRMA, if you have one, will be calculated on your tax return from 2018, 2 years back. You can appeal if you disagree. There is a form, SSA-44, and they may or may not agree with you, but you can always appeal. And IRMAs are paid directly to CMS, the federal agency that manages the Medicare program. So why am I making a big deal of that? Well, they're fairly significant. This chart here shows that in 2020, if you are joint for tax return and your 2018 was $170,000 or less, then you're going to pay the standard premium of $144.60 for Part B. However, if it's 1 penny above that threshold, up to $214, you can see that Part B premium goes up substantially. And there are actually 5 different premiums that you could be charged based upon IRMA should it apply to you. And you can see those for yourself there. You can also find this information on our website. If you go to amskc.com, we have a helpful resources tab. We've got a lot of information for you to download for free. Okay, so here's what we see commonly. I would say probably 2/3 of the people we talk to nowadays, when they're turning 65, they're working, plan on continue working, well beyond age 65, and there is some special guidance for how Medicare works when you're working beyond age 65. First of all, Part A, if you enroll in Part A while you're working, even though there may be no premium charge to you, it may negate your ability to contribute to an HSA or health savings account if you have one available to you. Now, please don't confuse HSAs, health savings accounts, with FSAs. That's a little different. But again, you can see page 19 of the 2020 Medicare and You for more information about that. Also, if you're working beyond age 65, it may affect your Part B enrollment decision. It may be to your advantage to delay enrolling in Part B if you have employer coverage based upon you or your spouse's active employment. If you have questions about that, always talk to your benefits administrator. You can always give us a call too. We're happy to help with that. I've taken this is a screenshot out of the Medicare and You booklet that goes over that. And it just says, again, if you or your spouse is still working and you have coverage through that employer, then you can delay Part B. You can delay Part A also. But there's very specifically here, coverage based on current employment does not include COBRA. I'm going to make a big deal about that, folks. We run into people that make some very unfortunate decisions on Part A and B. They delay it because they're paying COBRA, and that runs them into a problem. We'll talk more about that down the road. Retiree coverage. I'm no longer working for that company, but they've given me health insurance beyond Medicare age. You need Part A and B. VA coverage, that's another thing that does not free you from getting Part B penalties, and individual healthcare coverage like Obamacare. That's what that means. Okay, so get this question asked a lot too when I'm working beyond age 65. Should I stay on my employer's plan? Well, it depends. You may have a younger dependent that needs coverage under that employer's plan. They don't like the Obamacare options or something like that. Well, that's a personal decision. In some cases, cost and coverage is cheaper or more comprehensive. Many times the cost for the employee to be covered may be very small or none at all. It just may be larger for a dependent. And of course, personal preference. In some cases, people will decline their employer's coverage and go on Medicare, enroll in Parts A and B. Why? Well, do the math. It may be cheaper and you may have more coverage. There are times we run across folks that have their employer coverage, and it may have big deductibles, or it may have a $300-400 a month premium. If that's the case, it may very well be cheaper to go on Medicare A and B. And you can always ask the employer, hey, if I go off the health plan at age 65 but still keep working, I'm not costing you as much money in benefits, and maybe you can get a raise. Never hurts to ask, right? Okay, this chart here, again, this comes from page 20 right out of the Medicare and You for 2020, which again is available for you to download for free on our events page, on our helpful resources page. There are rules for how insurance works with Medicare. So if you have other insurance and Medicare, we want to follow this. So the very first column here says if you have retiree insurance, so you're no longer working, Medicare pays first, and I've added this in here. You must have Parts A and B because Medicare is paying first. If you're 65 or older, go to the second one, and you have group health plan coverage based on you or your spouse's current employment, and the employer has 20 or more employees. Your group health plan actually pays first in this case, and any leftovers go to Medicare A and B, typically none. This is where you can delay enrolling into Part A and or Part B, without any penalties, without any problems, and avoid having to pay that Part B premium. If you're 65 or older, Section 3, and you have coverage based on you or your spouse's current employer, however, the employer has fewer than 20, Medicare pays first. So you must have Parts A and B. And then finally, the last one is if you're under 65 and disabled based upon active employment, again, you can delay Part A and B. Okay, well, that's all well and fine, but what happens to me, Daryl, when my employer coverage ends? Well, you may get a special enrollment period granted from CMS. It allows you to sign up for Part A and or Part B without a penalty. And the time frame for doing that is within 8 months of losing that coverage based upon you or your spouse's active employment. Most people don't wait 8 months. Why is it an 8-month window? Because that's the way Congress wrote the law, and it just hasn't changed. But keep in mind, COBRA or retiree coverage are not based on active employment, and you may not get that special enrollment period. And if you don't get the special enrollment period, and now you want to add Part B, you can only do so during the general enrollment period for Part B. This is the only option if you're not granted a special enrollment period, and the time window that you can do it is January 1 to March 31st. You do the paperwork then, it becomes effective July 1 of the following year, and if you show up on April 1 saying I'm 1 day late, they will make you wait another year. Okay, so let's go into Part D. We've gone over Part A and B and some of the idiosyncrasies of that. Let's skip over C for now and go to Part D, drug coverage. First of all, there are 2 ways that you can receive prescription coverage under Part D. One is you can get what's called a standalone Part D plan. This is usually a companion to your original Medicare or red, white, and blue Medicare card. These are offered by private insurance companies, and you have many options. There are actually 28 different standalone Part D plans available here in Kansas and Missouri. Your second option would be a Part D plan built into an Advantage plan, or sometimes referred to as Part C of Medicare. And currently there are 32 Part C options just in Johnson County, Kansas alone. Now, to be eligible for Part D, if you're going to do a standalone Part D plan, you only need to have Medicare Part A or B. You don't have to have both, but you are eligible for just one. That is the standalone. If you want your Part D built into an Advantage plan, then you must be enrolled in both Parts A and B and continue to pay that Part B premium. You cannot be in jail. You cannot be living outside of the United States. You must live in the planned service area. You'll see that in the documents. Typically, it means either a state. In some cases, it can be county specific. And you must choose a plan, and you must enroll, fill out paperwork, either good old-fashioned paper or electronic, in order to get coverage. All plans have to offer at least the standard benefits. We'll refer to that as the benchmark, the minimum standard. Many plans offer higher levels than the minimum, and we'll talk about that here. So this is the standard benefit in 2020. Medicare often refers to these as having 4 stages, 4 phases. So you start with a yearly deductible, then you go to a co-payment amount, then you go into the coverage gap, commonly referred to as the donut hole, and then stage 4 is catastrophic. So your yearly deductible, and this is the minimum. Some plans don't have deductibles, but this is the floor. You start off with a deductible of $435. Then after you have satisfied that, your Part D plan will start to pay their share. You're either going to have a flat co-payment, or in some cases you might have a co-insurance amount, and you'll pay your part until the total reaches $4,020, and then you move into the coverage gap or the donut hole. It's you're expending in the calendar year, and these are always calendar year numbers. Once you reach 4,020 in covered drugs, it used to be in the donut hole, you paid 100% of the cost of your medicine. The laws have changed now, and in 2020, it shifts. You might see the dollar amount you're charged change, but you'll go to a flat 25% that you pay for brand name or generic drugs. And then there's a calculation of all these numbers to determine when you've paid enough and you move into what's called catastrophic coverage. This is based on $6,350 out of your pocket. It's not drug cost, it's what you've paid out of your pocket. And if there's calendar year left and you go there, you see your drug cost drop dramatically. Okay, so if you're like most people now, you've gone, what? I'm confused by all this. So let me translate a little bit easier. The way Part D works is once coverage begins, you're given a checkbook to pay for your Part D drugs for that calendar year. And the checkbook has $4,020 put into it by the government, and you cannot add more money to that available balance. So the total cost of your drugs is deducted from your balance each time you fill a prescription, including a deductible if your plan has one, and the copay, the fixed, $10 amount, $20 amount, there's usually a fixed amount, or in some cases it might be a coinsurance percentage. So for example, your drug costs $100 and your plan has a $0 deductible. So even if your copay or coinsurance is $25 and the insurance paid the other $75, the total cost of $100 is subtracted from your checkbook balance. So for as long as you have an available balance, you only pay your copay or your coinsurance amount, and the plan pays the rest when you fill your prescription. So if your math is good, since you've got $4,020 for the calendar year, if you assume a full 12 months in the year, it means you would have to spend more than $335 average cost each month to use up that balance and go into the coverage gap and see your coinsurance percentages change. Now in 2020, it's not as big of a deal as it used to be back in 2006 when Part D first started. So again, should you use your available balance mid-year, now you enter the donut hole of Medicare. As I mentioned, it used to be you paid 100% of all your cost when you're in the coverage gap. But now by law, all plans must discount the cost of your medicine down to a flat 25% coinsurance amount, whether it's a brand name or a generic prescription. What you pay and 95% of the discount that the drug company gave you for brand name counts as your out-of-pocket spending, and this helps calculate when you move out of the coverage gap and into the catastrophic. The catastrophic level, when you reach that, it dramatically drops your cost down. So you're either paying 5% or $9 basically for brand name, $360 for generics, the either or, the greater. And this always starts over every January. Excuse me. Yeah. Okay. Part D drugs, covered drugs, it must be a prescription brand name and generic drug. They are approved by the Food and Drug Administration. They must be used and sold in the United States, so you cannot use a Part D plan to buy your drugs from Canada. Includes your drugs, biological products. Insulin is a Part D drug along with the supplies, so test strips, lancets, that type of thing. And all Part D plans must cover a minimum range of drugs in each therapeutic category. But the coverage and the rules do vary by plan, and we can help you sort that out if you want that. Another thing to be aware of with Part D is formulary. Formulary is just a fancy word for a list of the drugs covered by the plan. If the medicine that you take is not on their list, on their formulary, then the plan does not have to pay. And the formularies can change every year. They won't change mid-year, unless the drug is deemed unsafe by FDA and pulled from the market, that type of thing. But typically what they change at the end of the year is the copay tiers. They might have like 4 tiers, and you pay a smaller copay for one level and you pay a higher on a different level. Sometimes at the end of the year, you may see a drug that was on one tier move up or move down. So always look at your annual notice of change in October. There are some drugs that are not covered by law under Part D. That would be drugs for anorexia, weight loss, weight gain, ED drugs. Your Viagras are not covered. Cosmetic or lifestyle, prescription vitamins, minerals, that type of thing, and non-prescription drugs and fertility drugs. Okay, so we've talked about Part D. We've talked about Part B penalties. Well, there are also Part D drug late penalties. There is a higher premium that could be charged to you if you wait to enroll, and it's calculated differently than Part B. It's 1% of the base beneficiary premium for each month that you were eligible and chose not to enroll, and you'll have that penalty for as long as you have Medicare drug coverage. This base beneficiary premium, this is the benchmark. CMS determines it. They release it every year. For 2020, it's $32.74. This can and does change every year. You will not be charged a Part D late enrollment penalty, however, if you had credible drug coverage or you get extra help, which we'll talk about. So if you're working, you have prescription coverage through your work, and that's why you delayed your Part D. Well, when that work coverage ends, you add Part D, you're not subject to a late penalty. So, Part D, credible drug coverage. This includes former employer union coverage, TRICARE if you're active military, or TRICARE for life. Indian Health Services, VA is considered as good or better than Part D, so you don't get a penalty if you choose not to enroll in Part D because you have veterans coverage. Individual health insurance coverage, that simply means Obamacare policies. Okay. So just like there was an IRMA on Part B, there is a IRMA on your Part D drugs. So again, what this chart is telling you is in 2020, if your AGI from 2018 shows you're above 170 if you're filing jointly, then you have a additional premium to pay for Part D. So YPP here simply says your plan's premium plus an additional $1240, $3190, so on and so forth. And again, you can always appeal your IRMAs. We can get you those forms if you need them. Okay, so we've talked about Medicare and how it impacts some of the IRMS things for higher income. Well, let's also talk about extra help for low-income people. And extra help is a specific name of the program created by the federal government. It's sometimes called Low Income Subsidy or LIS. And it's designed to help people pay prescription drug costs that are maybe struggling with their incomes. Excuse me. Oh. Okay. If you have lowest income and resources, and there are different levels of how this works, you might pay no premium and very little out of pocket for medical costs. Sometimes this is combined with Medicaid or QMB, which means Qualified Medicare Beneficiary. There is also middle layers where you might have maybe a higher income. You don't qualify for that, but they might knock your Part B premium, pay that for you, pay your Part D premium, and they might take care of extra things for you and just generally make your costs quite less expensive. It's free. It's a U.S. government program. We can help you with the application if you need it. You can call 1-800-MEDICARE and they'll take it right over the phone. Here is the extra help income and resource limits. I need to update my slide. This is 2020 numbers, but it's basically if you're below $1,561 per month as an individual, chances are you will qualify for some extra help paying your premiums and deductibles and co-insurances. So ask us. We can help you get signed up for that. Again, it's all run by CMS, the federal agency that manages Medicare. This is not an insurance program. This is a government entitlement. So while we're talking about that, sometimes people will confuse Medicare and Medicaid. So I want to talk about Medicaid. You may qualify for free or low-cost care through Medicaid, and this is based on income and family size. In all states, Medicaid provides health coverage for some low-income people, families, children, pregnant women, the elderly, and people with disabilities. In some states, the program covers all low-income adults below a certain income level. And while they sound similar, Medicare, Medicaid, they are two distinctly different federal entitlement programs that provide coverage to two different populations. And while it is possible to qualify for Medicare and Medicaid at the same time, most people do not. Okay, so now let's take a look over at insurance company Medicare Options, and let's take a look at some of the different puzzle pieces and see how they all fit together. So there's basically two ways that you're going to obtain your Medicare coverage. And I've got a red divided line here because it's an either or. For the Star Trek fans, they're like matter and antimatter. They do not mix. So option one would be to enroll in original red, white, and blue Medicare. And I got my red, white, and blue Medicare card, and I'm paying my Part B premium. Then you would decide, do I want to pick a Part D drug plan? Choose your plan, enroll, and you're going to get a new card for the Part D, and you're going to pay that Part D plan premium also. Then you can decide, do I want to buy a Medigap plan? The government refers to Medicare Supplements as Medigap. So if you see Medigap or Medicare Supplement, it's potato. It's the slightly different name for the same thing. So you can decide, do you want to do a Medigap plan? That would be enrolling in a plan, paying a premium, but that Medigap is going to cover a large portion of the leftovers that Medicare leaves for you to pay. So that would be a card and a premium, a card and a premium, and a card and a premium. So you'd have 3 different cards, 3 different premiums. Works well, but it's one option. Option number 2 would be to evaluate whether you wish to enroll in a Medicare Advantage or Part C program. Now, you enroll in original Medicare Parts A and B, and you still have to pay your Part B premium. But you can pick a Medicare Advantage company, fill out paperwork for them, and they will give you access to your hospital, your doctor, and in many cases, Part D drugs all in one card. In many cases, if you pay your Part B premium, you may not have any premium for the Advantage plan or a very small one. But these all use networks, either an HMO, which is a small network of hospitals, usually at a lower cost, PPOs, which are a larger network of providers at a little bit higher cost. If you're used to health insurance through where you work, these may be somewhat comfortable to you, but it's just another option. Okay, so let's take a look at option 1 at Medigap or Medicare Supplements. Okay, well, first of all, Medicare supplement policies, premiums typically will increase with you as you get older. All Medicare supplements are issued at what's called guaranteed renewable by law. And this simply means as long as you pay your premiums, you cannot be canceled, you cannot be singled out for rate increases. If you buy a Medicare supplement in Kansas and then you move to Alaska, you move to Florida, wherever, that plan will go with you, no problems. All plans have been standardized by federal law, which means a Plan F or a Plan G or whatever the plan code is from company X, Y, or Z will have exactly the same coverage by law. It was designed to make it very easy for Medicare members to price compare. And thirdly, Medicare supplement plans do not include drug coverage. So if you wish prescription drug coverage under Part D, you must pick a standalone Part D as a companion to that Medicare supplement. Now this chart here, this comes out of the Medicare and You. You'll find it on page 70, When I say that Medicare supplements are standardized, this is the formula that the government used. So in this first column here, these are all the benefits or the leftovers that Medicare would leave a member to pay, your deductibles, your coinsurances, and so forth. And so if a Medicare supplement company wants to offer a plan, they have to offer A, that's the minimum benefits. You'll see the different categories, C and F are kind of been phased out to a degree, G, K, so on and so forth. But they are designed to cover all these leftover expenses. So if you're looking at a Plan G or a Plan L or a Plan N from any company, they all have this structure. It's very easy to price compare. There's some other things we look at too as far as premium stability with the company, members, and that type of thing. But they're incredibly simple to compare. Okay, so how do I qualify for a Medigap or a Medicare supplement? Well, when you're first applying within 6 months of your Part B coverage effective date, you cannot be turned down. There's no health questions. The application is basically your name, your address, how do you want to pay for the plan, and move on. Once you've had Part B in effect for more than 6 months and then you decide you want to add a supplement or maybe switch, then you do have to answer the health questions. And the carriers, the insurance companies, can use those questions to decline coverage or possibly offer you coverage but at a higher premium. Some people get really upset about the health questions. It is something to be concerned about, but many people don't have any issues going through underwriting. If that ever is a concern for you, you just give us a call. So one of the things, all right, so I'm going to go back here just to make sure that we didn't lose you on something. Talking about basics of Medicare supplements. Again, you can't be declined when you first 6 months. Ask the health questions. There are no networks with Medicare supplements, so you don't see an HMO or a PPO supplement. They work with any provider who accepts the Medicare program in all 50 states. You do not need Medicare supplement company's approval to get a procedure done ahead of time. If Medicare covers the bill, that leftover goes to the supplement. They have to pay it, end of story. And you'll never need a referral from your family doctor, your primary care, in order to see a specialist when you have a Medicare supplement or Medigap policy. And basically, you're paying a very large premium for them because they're covering all or most of original Medicare's deductibles and coinsurances, depending on the type that you selected. It is the largest monthly plan premium that you can pay, but many people like the prepaid convenience. They know I've got a budget amount, I pay X amount every month for my supplement, and then I have very little leftover medical bills when I go to the doctor or when I have my medical treatment done, wherever it is. And some people like that. One key thing with Medicare supplements, they only cover one person. So if a spouse wants coverage, each spouse must obtain their own separate policy. Okay, we get asked a lot about this. Well, maybe not as much anymore, but people were all concerned about Plan F going away. Plan F covers 100% of anything that Medicare leaves left over for you. And Congress decided that that was causing people to buy Plan F, and then they would overuse health services because it didn't cost them anything. Doctors say you want an MRI, and the Plan F policyholder would say, give me 2, it doesn't cost me anything. Bit of an exaggeration, but that's why Congress phased this out. So some people were really anxious about it, but basically, if you have a red, white, and blue Medicare card in your pocket, and your Part A or Part B have a date of January 1, 2020 effective or later, the government will not allow you to buy a Plan F anymore. If you have one or you know someone who does, they're not losing it. It's guaranteed renewal for life. They can never lose it. And if you started your Part A in 2019, but you delayed your Part B because you were working, if you really want a F, you can buy one as long as your Part A effective date was before January 1. As you'll see, this is really not an issue, folks. Don't even let anybody get you all riled up about Plan F going away. Okay, so that's enough of the dry stuff about Medicare supplements. Let's take a look at option 2, which is Medicare Advantage. And again, Medicare Advantage should never be called a supplement. It's a totally, as they said in The Wizard of Oz, it's a horse of another color. What you'll find with Medicare Advantage is a dramatically lower premium than if you choose a Medicare Supplement or Medigap, and most Advantage plans include Part D drug coverage built in on the one card. Now, your premiums and your benefits of the plans can change a little bit every year, and if you're used to employer health insurance, you probably see the same thing with that every year. And by law, all Medicare Advantage plans must cover all Medicare-approved services. However, they are free to, if they feel they can afford it, offer additional services not covered by Medicare. For example, you may find Medicare Advantage plans with built-in coverage, extra coverage for dental, vision, even hearing aids, and a host of extra things. With your Advantage plans, you do have networks or lists of doctors and hospitals that you either should use to get the lowest cost or you must use to have coverage. In the case of an HMO, PPO is a little bit broader, and we'll talk about that a little bit more. Okay, so the different types of Advantage plans. Here we have our HMO. HMO stands for Health Maintenance Organization. This is a very smaller, typically network of doctors and hospitals that you can use with that plan. And as you can see, if you go out of the network, typically it's not covered. So again, typically with an HMO, if you're happy with the smaller network, you will find the lowest cost options. You generally have prescription drug built in. It is, like I said, a smaller network of providers, and if you use a non-network provider, unless it's an emergency, you're paying that bill 100% yourself. So you need to know that in these cases. HMOs have no out-of-network coverage except in emergencies. Now, you may need prior authorization. In other words, I like to call that a mother may I slip. In order to have certain things done, the plan will let you know. You can also need a referral from your primary care doctor in order to go see a specialist. Some of these plans do offer a lot of extra benefits. If you're willing to accept the network and some of the limitations, you may get extra dental, vision, hearing aid coverage. Many of the plans also offer gym memberships at no additional cost. So there's a lot of positives, so you just need to know how they work. Your other option is typically a PPO. And in a PPO, it's called a Preferred Provider Organization. It is a moderate cost. You're going to pay a little bit larger copay with a PPO than you would with an HMO. And again, they typically include your prescription drug coverage built in. You'll also find a larger network of medical providers, typically in a PPO or preferred provider. And if you use a doctor who's not on the list, as long as he's willing to build the plan, you still have coverage, but you're going to pay more. That's how it works. And in PPOs, you generally have access to medical providers, or you may, depending on the plan, have access to providers in other parts of the country. Snowbirds that live in Kansas, Missouri in the summer, and then go down to Florida, Texas, Arizona. In some cases, they can use a PPO Advantage plan and still have coverage in both states. With a PPO, you may need prior authorizations. Typically, though, you'll never need referral to see specialists, and most people find it is much less restrictive than an HMO. And again, you'll find you get a lot of extra benefits: dental, vision, hearing aids, hearing coverage depending on the plans, and again, the gym memberships. So they're not bad, they're just different. Medicare Advantage is another option under Medicare, and you make your decision on what you like, and we can help walk you through that process. So here, when you're comparing them, HMO is usually less expensive, lower cost, lower copays, smaller network, and you must stay within the network, so you really lose some control. PPOs are very popular because it's much larger. You can move around, you can go out of the network and not worry about having to pay 100% yourself. So, some of the things to keep in mind because your medical provider network is local. So, in other words, if you were to enroll in a Medicare Advantage plan and you lived here in Kansas City, but you take a trip and you've gone to New York, for example, you're going to go see a play on Broadway. Well, your doctors are still here in Kansas City, even though you're in New York. Well, under Medicare rule, Medicare Advantage plans have to accept all the rules that the CMS, the government, puts on them. Same as doctors. According to Medicare, page 56 out of the Medicare and you are always covered for emergencies and what are called urgent care anywhere in the U.S. from any medical provider who accepts Medicare. So in other words, you step out of the cab on Broadway, you go to walk in the theater, you twist your ankle on the curb. That's not an emergency, you're not going to die, but it does qualify under Medicare's definition of urgent care. You have a condition which would cause a prudent person to seek care. You can go see any doctor who accepts the Medicare program, show him your Medicare Advantage card, he will bill it, and the Medicare Advantage company will pay his bill just like if you were in network because it's Medicare rule, and if they don't, they're not going to get to play in the Medicare sandbox, and there's a lot of money involved there, folks. So just be aware of that. So Medicare Advantage plans receive money every month directly from Medicare, and that's how they offer the coverage. You'll see Medicare Advantage plans at a zero premium in many cases because of the federal funding. But the contract and the rules are those plans must follow all of Medicare's rules. So they can't deny you coverage because they feel like it. For billing purposes, if you join an Advantage plan, the Advantage card that you get is your Medicare card, and should be the only card that you would present to any medical provider. You would keep your red, white, and blue Medicare card home, keep it safe in case you ever switch back to it, but you only show your Advantage card when you're on that. And if you don't like your Advantage plan, you can change your company every year during the upcoming annual enrollment, and we'll talk about that in just a little bit further down the slides. Okay, sounds great. How do I qualify? Well, you must live in the plan's service area, and with Medicare Advantage, these are typically county specific. You must be enrolled in original Medicare Parts A and B, and you must continue to pay your Part B premium. There are no health questions with Medicare Advantage. The only thing that can stop you from enrolling in a Medicare Advantage currently is at the time of application if you have end-stage renal disease, which is permanent kidney failure requiring dialysis, you're waiting a kidney transplant. That is the only thing that can stop you currently from enrolling into a Medicare Advantage plan, and that is going to change starting next year. That will go away. You can only join one plan if you live in the service area. There's no health questions. If you move out of the service area, then the plan is required to disenroll you. So if you have an Advantage plan and you live in Jackson County, Missouri, and you like it, everything's going great, but now you decide to move to Indiana, say. Once you notify the plan or you notify Medicare that you no longer live in Jackson County, you have 63 days to select a new plan based on the new county that you live in, or you can buy a Medicare Supplement, Plan A, B, D, G, K, or L in that new county in Indiana without any health questions, and that's referenced on page 22 of the Choosing a Medigap Policy Handbook. So you can never get left without coverage in the Medicare program. Okay, I missed that one. So let's talk about enrollment periods. Timing is everything. To understand enrollment periods of Medicare Part D and Medicare Advantage, it is a critical thing. These are your time windows when you can make changes if you want, sign up, and if you miss a window, you either might run into a penalty or have to wait. All enrollment periods are governed by CMS, the federal agency that manages the Medicare program. So all of these companies must follow the rules that's set down by CMS. So first enrollment period that we look at is you're new. Okay, so again, this is that initial enrollment period that we went over earlier. you're new to Medicare and you enroll for the first time in Part C or Part D, you can do it 3 months prior to the month you turn 65, the month you turn 65, or 3 months after for a total of 7 months. Once that time window closes, if you did not elect coverage, you must wait for the annual or hope to have a special enrollment period made available to you to enroll. And this again is that 7-month initial enrollment period window. So again, you have your center point 3 months before, the month of, and then 3 months later. Okay, but there's also a time for a change. So AEP, which stands for the Annual Enrollment Period, sometimes referred to as Annual Open Enrollment Period. This is a time window that runs from October 15th through December 7th of every year. And it's during this time window where one may enroll in a Part D plan, enroll in an Advantage plan, change from one plan to the other, get rid of an Advantage plan. I don't like it anymore. I want to go back to original Medicare, whatever you want to do. So if you're working somewhere, you probably are used to having annual enrollment period where you work. Raise your hand. Do you want to change benefit options if they have more than one option? This is the same thing with CMS and Medicare. If you like what you have, you don't have to do anything during the fall. If you're new to Medicare, you're turning 65 soon, you're getting a lot of junk mail right now. And again, we sent you the postcard, so we contributed to that. For that, my apologies. But you ain't seen nothing yet till October comes around. You're going to get bombarded with more mail. But if you're happy with your plan in the fall, they will send you, your current plan will send you their ANOC letting you know what their changes are going to be. If you're happy with everything, you don't have to do anything. Your plan will automatically roll over the next year. But once AEP closes on midnight December 7th, if you want to change but you didn't, you're stuck. Okay, there is an exception to everything, and for my golfers out there, can I get a mulligan? Can I get a do-over? Well, Medicare started this this year. It's called the OEP, or Open Enrollment Period, and this starts January 1 to March 31st. This is a switch period, and it only applies for people who are already enrolled in a MAPD or a Medicare Advantage plan. Members can change their Medicare Advantage plan or disenroll altogether and go back to original Medicare, pick a standalone prescription drug plan. There's no mailing, there's no marketing, there's no TV commercials about it. It's meant to help people who made a oops. But there are special enrollment periods also. I mentioned that. This means something special has happened that allows you to change or add your Part D or your Medicare Advantage plan during the calendar year. And special enrollment periods usually last for 63 days after that special event has occurred. Some common special events, SEPs, around loss of employer group coverage. I turned 65 5 years ago. I enrolled in Part A, but not in Part B because I had my employer coverage. Now I've lost it. The company shut down. I retired, whatever. That would be an SEP. Add Part B, you can add a drug plan, you can add an Advantage plan. Loss of creditable drug coverage. I'm a retiree. My company gave me prescription drug coverage when I went on Medicare at age 65. And now 5 years later, 10 years later, whatever, they've gone bankrupt and they've taken that drug coverage away from me. That would be mid-year. That would give you the right to add a Part D drug plan during the calendar year. If you move from one state to the other, that could trigger a change. And there's all kinds of different SEPs. Okay, so we've gone through a lot here, and now I always like to help kind of apply some of these things and see if the lessons stick. So we're going to take a look at a couple scenarios, and I've made these people up. We're going to look at Bob and Carol. So it's March 2nd, and Bob is 68 years old. He's retired, but he's had employer coverage through where his wife Carol works since he was 65. He enrolled in his Part A, but he did not choose Part B because he had coverage through his wife. But now he's losing this coverage at the end of the month, end of March, because Carol's retiring at the end of March. She turns 65 in April, and she's planning to enroll in Medicare. So what do Bob and Carol need to do to ensure that there's no interruption in their coverage? Well, Bob will need to enroll in Part B right away, and Carol will need to enroll in Parts A and B by March 31st in order to have the coverage effective April 1. Social Security office facilitates the enrollment paperwork. Bob will have a special form. He'll be asked to have Carol's employer verify that the reason he delayed his Part B was that, yes, he did have coverage through Carol's active employment in order for his application to go through and avoid any penalties. And if that applies to you, you can find those forms on our helpful resources page. Once Bob and Carol have applied for A and B, they can start shopping for Part D drug coverage. They can look at supplemental coverage, Medicare supplement coverage in their area. They can also choose to evaluate Medicare Advantage plans and Part D drug coverage if it's available to them in their area, because Medicare Advantage plans may not be available in every state or every county of a state. All right, so that was simple enough. Well, we're going to take a look at a common situation that we see from time to time. I call it Mary's Dilemma. Mary is 74 years old. She takes very little medicine, 2 generic high blood pressure pills that she can get for less than $4 a month. She's never enrolled in a Part D plan over the last 9 years because she thinks it's just a waste of premium. Why do I want insurance to cover an $8 a month expense? Well, it's May, and she's just had a cardiac event, a heart health issue of some type. And her doctor is now prescribing 2 brand name heart medications that cost over $400 a month for her heart condition. What happens to Mary now? Well, since it's May, Mary's next chance to enroll in a Part D drug plan is the annual enrollment period of October 15th through December 7th to fill out paperwork for that coverage to become effective January 1. So she will have to pay 100% of her medicine cost or see if she can get manufacturer assistance programs, and these are generally based on income, but they can be available. When she enrolls in Part D, she will also be subject to a lifetime late enrollment penalty, or LEP, of 1% for each month she was eligible for Part D but chose not to enroll. So, for example, the months Mary was eligible but did not enroll, I've got 108. That's 9 years, she's 74, times 12, or 108 months. So her benchmark premium is multiplied by 108% to calculate what that penalty is. In 2020, the benchmark premium is $32.74, so times 108% is $35.36 is her late premium penalty. However, Medicare rules, they round up to the next dime, so $35.40 will be added to her monthly premium of the Part D plan she chooses, if she does choose one at the next enrollment period. So even if she were to enroll in a zero premium Advantage plan that had Part D drug, they would tack on $35.40 for life. So the end result of Mary's decision is that, number one, she cannot obtain drug coverage under Part D until the following January. It's May, so she's got 7 months to pay 100% out of her own pocket. And assuming Mary does enroll in a Part D plan, she has the plan premium plus the late enrollment penalty for the rest of her life. So I have mixed emotions about the penalty. You could say that for 9 years she didn't pay a premium, and that extra, it may or may not be a big deal to you. But anyway. Okay, this is the one that hurts the most, and this is one of the more frustrating things. Dick's early retirement offer, I call this scenario. So Dick is 63 years old, he's single, and he's worked for Acme Company for 40 years when the company offers him an early retirement offer. The offer includes 1 month of group health insurance coverage paid for by the company for each year he's been employed. Acme's a huge company. So Dick does the math. He's going, well, heck, I've been there for 40 years. I'm going to get 40 months, almost 3.5 years of free health insurance coverage, and I can get a job somewhere else? Why not? So he figures he'll take it. He'll take and run on the free health insurance until he's 67, and then he'll just switch over to Medicare and a supplement when it runs out. So Dick enrolls into Medicare Part A 2 years later when he turns 65. But he declines the Part B premium because he doesn't want to pay the Part B premium because he's got free continuation of coverage benefits. And he's had absolutely no problem with the company benefits before. And he's doing the math. Hey, I got another 18 months or so before my group insurance runs out, and I don't want to pay $144.60 a month. Okay, well, I got coverage. It makes sense, right? Well, 6 months later, Dick goes to the doctor for the first time since being eligible for Medicare. So he shows them his red, white, and blue Medicare card with Part A, and he shows them his company's group insurance card, and they send it to the doctor's billing office. 30 days later, he gets a bill from the doctor saying that Medicare denied his bill, and so did his group insurance through Acme. He is madder than the proverbial wet hornet, as my dad would say, and he's furious as to why his insurance is denied. Well, here's the catch. Medicare follows the government rules. My dad was in the Army. He served the tail end of Korea, and he used to joke if it wasn't Form 32J signed in blood in triplicate by the commanding officer, nothing happened. I never understood that as a kid, but I do now, having worked with Medicare. Page 18 of the 2020 Medicare and You states, if you or your spouse is still working and you have health coverage through that specific employer or union, it might be to your advantage to delay Part B. Remember this screen? Remember, coverage based on current employment doesn't include COBRA, retiree, VA, and this is considered a similar, it's a continuation of coverage. He's not working through that company anymore. So you or your spouse must be actively working with that employer who's giving you the coverage to delay Part B while you're covered under that employer's group insurance. Employers with 20 or more employees, that group insurance coverage is considered primary to Medicare. Retiree coverage, COBRA, or in this case, a continuation of benefits following an early retirement or layoff, while many times it's quite comprehensive, it's very good coverage, it's not based upon active employment and generally requires the member to enroll in Medicare Part B. It also pays secondary or after Medicare, and that's why you have to have both A and B. So I'm going back to this slide here because this is one of the more frustrating things that we run into. People will select COBRA coverage and they won't take their Part B because COBRA is a very costly premium. So again, right here it tells you if you have retiree insurance, insurance from your or your spouse's former employment, Medicare pays first. You must enroll in both Parts A and B. So Dick now must wait for the Part B general enrollment period, the time to do paperwork, January 1 to March 31st, to enroll. He will pay a late enrollment penalty of 10% added for each full year that he delayed his Part B, and his Part B coverage won't start until the following July after he does his paperwork in January, February, or March. So since Dick's Part B coverage won't be effective until July 1, he has no Part B coverage for doctors, emergency rooms, labs, x-rays, outpatient surgeries, you name it, until July 1 as well. This is extremely frustrating. So always talk to your benefits administrator about how your group or retiree coverage and how it coordinates with Medicare. You can give us a call. You can call 1-800-MEDICARE. They'll take it over the phone. But just because it makes sense to you doesn't always mean it's going to follow Medicare's rules. Well, Medicare can be confusing, and our time is quickly running out. You may have many more questions. Medicare is a topic we could easily devote several hours to, but yeah, the mind can only absorb what the butt can endure. I do appreciate and hope very much that you'll give us some candid feedback on what you liked on today's program. Please leave us a comment on YouTube. Tell us what you liked as well as what you didn't like. If you don't want to do that, you can send us an email with your feedback. And no, we won't sell your email address or send you a bunch of spam. Our general mailbox is info at amskc.com. And we would very much appreciate you clicking the thumbs up button on our YouTube channel if you like the class. You may consider subscribing to our channel to be notified on future videos. And we do little snippets on different subjects, try to keep them short. So if you're like many people now, you're thinking, well, what's my next step? I like the information. It's been a big help. If you would like help enrolling into Medicare and to make sure you avoid any missteps or penalties, give us a call. We are happy to help you, and our services are provided at no charge to you, and I'll explain that in just a minute. We can also help you compare cost and benefits for just about any plan out there: Medicare Supplements, Part D drug coverage, the Medicare Advantage plans. And I've taken a picture here. If you go to Google Maps, type in Affordable Medicare Supplements, you'll find us. We're right next to the Hy-Vee at 95th and Antioch. Very easy and convenient, and we do currently take appointments. There's some screening. We have a touchless thermometer, all that type of thing. So how does AMS work? Well, we are an independent insurance agency, and we have contracts with over 40 different insurance companies. The computerized software programs, and we can very easily quote and compare reports for you. We also invest heavily in computer technology. I'm a self-professed lover of gadgets. Thanks, Derek. I appreciate the comment. We invest heavily in computer and technology. We can also do, if you're concerned about COVID, which rightfully so, we do have the capability to do phone meetings and screen sharing programs. We use a product called GoToMeeting. It's very similar to Zoom that you hear about. And if you choose to use our services and you enroll into a plan, AMS does receive a commission from the insurance company that you choose to enroll in. By federal law, Part D and Medicare Advantage commissions are all standardized or equal. So if you want an Advantage plan from company X, Y, or Z, we get paid the same. Medicare supplement commissions do vary slightly, but they're comparable to Advantage commissions. Our goal is really to help you get the best possible coverage for your healthcare needs and budget. My philosophy, I've been in sales for a long time. Zig Ziglar, if you've ever listened to his stuff, people love him or hate him. But he had one saying that I really, really loved, and that was, you will get all you want in life if you will help enough other people get what they want. And that's what we try to do here at AMS, help you make sense of Medicare. And more importantly, we love to provide ongoing annual service. So you'll always get annual reviews. We'll keep you updated. And if you need to make changes or something's not right, we can help you out in that. We also have great relationships with the insurance companies in the area, so that if there is an issue, in some cases we can get them resolved faster. Plus, nobody likes to call 1-800-1 for this, 2 for that, 3 to throw your phone out the window. So hope you found it helpful, folks. Again, thanks for attending. Leave us a comment, give us a call if you've got more questions, shoot us an email, give us a text. Again, thanks for stopping by, and have a good night.